So we'll call the August 2022 meeting of the Local Alcohol and Drug Planning Committee meeting called to order. I cannot hold a candle to Eric, but I am here because Eric is not here. So hopefully we'll have a very positive experience today. I'm sure we will because of what we'll be sharing. So that's great. So Rochelle, do you want to do the roll call then?
Yes. Jack Atkins.
Present.
Justin Hahn. He's here. Did he leave and come? Okay. Rosemary Jernigan.
I'm here. Thank you.
Brandon Orr.
He's here. Hey, Brandon, can you say here?
I'm here. Can you not hear me?
I can hear you now.
And
Okay,
now.
I'm here. Present. Thank you.
Heather Phil.
Here.
Nick Wrighton.
Present.
Sarah Smith.
Here.
And Mary Wallace.
Hey, Mary, are you able to say present or here?
I'm here, sorry.
Thank you.
Okay. Should we introduce our guests today now? And then go into the business?
Sure.
Okay. You're probably better equipped than I to introduce people, I hope.
Okay, so I'm not sure everybody. I do know we have two folks here, Tiffany Atkinson and Vicki Westbrooks, who are applicants, but the other guests, they will need to introduce themselves.
Okay, great. So committee business, we have approval of meeting minutes for May 25th, 2022. Assuming that people have read them, you know, who would like to read them? Would someone move to accept the minutes as approved, and then we can discuss any changes that might be needed?
I move to accept the minutes.
A second.
Thanks, you guys. So then do we do the roll call again, Rochelle?
You can do that, or you can ask if anybody opposes.
Okay.
All in favor can say
Does
aye.
anybody have any corrections or opposition to the minutes that were emailed to you? Okay. Any opposition to approving them as you receive them? No. Okay, great. So the next activity is to discuss and deliberate about the two applicants who have applied to fill current vacancies. I think we have a total of 3 vacancies and we have 2 applicants with us today. So one is Tiffany Atkinson and the other is Vicki Westbrooks. Tiffany, you want to introduce yourself?
So my name is Tiffany Atkinson. I'm currently the program manager for the Resilience and Recovery Project in Jackson County. We have a couple of programs in the area. I'm also a person in long-term recovery. So I am.
Thank you. Vicki, you have sound now?
My name is Vicki Westbrooks. I've been a resident in Medford for over 30 years. I was a legal receptionist until I retired 2 years ago. I've been very active in the community the last couple of years, and I've just have a desire to get out there and do some good and work with some more people. And so that's why I'm here. I have a heart for helping people get what they need if they have alcohol or drug problems, and that's why I'm here. I just want to be able to help people. I'm willing to do anything I can.
Thank you, Vicki. Let's see, do we have a motion to nominate Tiffany Atkinson to the county commissioners? Maybe that's a good way to put it. We would recommend her. Anyone on the committee itself can make a motion.
I make a motion.
Thank you, Brandon.
Second that.
Can I just ask, Sarah, so did everybody get a chance to actually read their applications? And Sarah, were you planning on like having a section for people to have discussion or ask questions?
Yeah,
Folks?
yeah, I thought we should make a motion to recommend this person, then we can discuss the motion.
Okay. Okay.
So, okay, so we have a motion that's been seconded to recommend Tiffany. Are there any questions for her or discussion before we vote on the motion?
I just wanted to ask one question, and I have read the applications as well. I'm Stacy Brubaker. I'm the Department Director for Health and Human Services for Jackson County, and currently the staff to this committee, along with Rochelle. So I just wanted to make sure, and maybe ask a question about what your hope and understanding is of this committee and why you want to serve on it.
So initially it was presented to me by a couple of people that I work with. I've never been involved in an actual committee, but I think my biggest desire is just to be able to make an impact in the community that I have lived in for a number of years. I think that because of my lived experience and in the role that I currently hold as within the Pathfinder network, I have a pretty good understanding of the things that are going on in the community and some areas that need growth and improvement. And so if there's any way that I can be a part of working towards a solution, then that's what I would like to be a part of. So did that answer your question, Stacy?
Yeah, thank you.
Okay.
Thank you. Other questions? I hope I'm seeing everybody. I don't see any raised hands or other questions. So should we vote on the motion then, Rochelle?
We sure can.
Okay. So we need to do a roll call for that, and it's to recommend Tiffany Atkinson to the county commissioners to be on the LADPC. I think that's right.
Yep.
Okay.
Okay. Jack Adkins,
Yes.
Justin Hahn. Okay, sorry. Rosemary Jernigan,
Yes.
Brandon Orr,
Absolutely.
Heather Phil,
Yes.
Nick Wrighton,
Yes.
Sarah Smith,
Yes.
and Mary Wallace.
Yes.
Okay, the motion passed.
Great. Okay. Thank you, Tiffany. Well, you'll get an official result after the commissioners meet, I think. So Vicki, let's see. I've lost you on my screen, which doesn't matter ultimately. There you are. I'm sorry. Do we have a motion to recommend Vicki Westbrooks to the county commissioners to be on the LADPC?
I move to recommend Vicki Westbrooks to be reviewed by the commissioners for the board.
Thank you, Mary. Is there a second?
I'll second.
Thanks, Brandon. Do we have any questions for Vicki at this time?
I would just want to ask the same question of her that I asked of Tiffany. Just the understanding of the role and what you would hope to be able to do on this committee.
I guess it's going to be learning in progress. I have read exactly what the board's about, and I have time and I've got dedication and experience, well, professional experience. So I just want to be able to help in this particular board.
Thank you. Could you describe a little bit your understanding of addiction and how it can be treated?
Well, from what I understand, there aren't, I don't understand all the treatments that are out there. I know that they're doing the new mushroom treatment that's been approved. I haven't ever been addicted, so I'm not an alcoholic, so I don't know from that perspective.
Okay, thank you. Are there any other questions for Vicki? Okay, I don't think I see any, so we can go ahead and vote on the motion to recommend her to the county commissioners for LADPC.
Okay, Jack Adkins,
Yes.
Rosemary Jernigan,
No.
Brandon Orr,
No.
Heather Phil,
Yes.
Nick Wrighton,
No.
Sarah Smith,
No,
and Mary Wallace.
Yes.
Motion did not pass.
okay. It's a public meeting and you're welcome to stay for sure. Thank you, Vicki.
All right, thank you.
So the next activity would be to hear from the Health Justice Recovery Alliance for approximately 20 minutes.
Hi, good afternoon. Thank you, Chair and community members, for the opportunity to speak today. My name is Dory, and I'm happy to meet you all. I'll give you a heads up. I might, this comes from many years of working with the CCO, so I might have a lot of acronyms. So we actually are from the Health Justice Recovery Alliance, or HJRA. I am the Behavioral Health Resource Network Outreach Director, and we're a statewide advocacy agency or organization whose sole purpose is focused on the implementation of Measure 110, making sure that it's implemented the way the voters intended it to be. And today we're hoping to give you a little update. I'm just a little bit about me. I'm an Alaska Native. I moved here most recently from the Bend area, where I spent 14 years. I have many years of, again, working with the CCOs in Central Oregon, as well as the Portland metro area. And I'm very passionate about Measure 110, as I've been an advocacy for addiction services, as I actually saw firsthand with my own family. Access to services as an Alaska Native was either very limited or not available in Central Oregon. So that's how I am here. I'd like to introduce my coworker, Ron Williams, our outreach director here at Health Justice Recovery Alliance. Ron's also a tri-chair for the Oversight and Accountability Council, which is, we call the OAC, in relation to Measure 110.
Hi, everybody. Thanks for having us. As Dory said, we're providing an update on the implementation of ballot Measure 110. As she mentioned, that we're an advocacy organization that educates stakeholders, community leaders, elected officials, and the public, the general public, about ballot Measure 110. And we've been working since the law was passed. We have a full team of folks, government relations, executive director, media person, coalition director, and myself, the director of outreach. And we've been talking to folks all over the state since the law was passed, working towards implementation. And what we have, last year we did a significant round of presentations to the legislature, governor's office, law enforcement, most of the local public safety coordinating councils. We did a number of presentations, and so we're kind of circling back to a number of the counties that we presented to, but this time we're adding the local alcohol and drug policy councils to the list of organizations that we're providing an update to. And I'm going to share my screen and get into the presentation. So, as Dory said, we're with the Health Justice Recovery Alliance. We're here to do an update on ballot Measure 110 implementation. Just as a reminder, what ballot Measure 110 does, it decriminalizes small personal use amounts of drugs. It does not legalize drugs. It essentially removes criminal penalties for possession of small amounts in favor of a health-based, science-backed approach to substance use. It was specifically tailored to meet the needs of Oregon, drawing on best global practices and the idea that rather than labeling drug users as criminal, Measure 110 treats substance use as a public health issue. Measure 110, people, as a result of Measure 110, people in our communities seeking harm reduction and addiction recovery services will now be able to access those services more quickly, closer to home, and by someone who shares their culture and or language. So it decriminalizes, and this biennium, the legislature, the appropriation is $302 million for the addiction recovery and harm reduction services. The services include low barrier treatment, which include detox, sobering, and outpatient. Peer support services, it's a vast expansion of peer support services, peer wellness specialists, certified recovery mentors, family recovery mentors, and I think I said peer wellness specialists. It's a vast expansion of harm reduction and overdose prevention services, and a significant increase in recovery or housing first housing, serving folks with substance use, who have substance use or substance use disorder. And there are many types of housing, everything from emergency housing, family housing, permanent housing, recovery housing, supportive housing, which is how we're identifying the housing first model, transitional and long-term housing. And the idea fundamentally, again, is to treat people with substance use through a healthcare approach. So I'm sure most folks may know or may not know that once ballot measure 110 passed during the 2021 legislative session, the Senate Judiciary Committee renamed itself the Senate Judiciary Committee and on ballot measure 110 implementation. And they brought together key stakeholders from all over the state, from law enforcement, from district attorneys' offices, from providers, folks from the legal community, folks from the social justice advocacy community, treatment providers. They brought in a number of folks and developed a main work group, and then a health recovery work group, and then a criminal and legal issues work group. And they worked through ballot measure 110 and made some significant adjustments. The first being they established behavioral health resource networks in all 36 counties. Originally, there were going to be 13 kind of regional addiction recovery centers, and it was thought that it was better to establish a behavioral health resource network in every county. That was number one. Number two, it directed the Oversight and Accountability Council to prioritize funding for communities that were most impacted by the war on drugs. It also added the law was silent on the 9 federally recognized tribes, so they were included in the law. As a matter of fact, the funding for the tribes out of this, the $302 million, the Oversight and Accountability Council set aside 4% to be distributed among the tribes. That they came up with their own formula to develop Measure 110 services in their communities based on that allocation, about $11.2 million. Senate Bill 755 also established that youth be referred to the juvenile system rather than adult courts, and youth could also be required to sign a accountability agreement with the court. Number 5, the law, Senate Bill 755, restated that law enforcement should be able or will give information about how to obtain a screening to individuals that get the E-class violation, and that information was distributed widely. Police departments, sheriffs and chiefs and state troopers know all about it, and that's been ongoing, and so that's been happening, but that was a result of Senate Bill 755. And the last thing is that the Secretary of State's office is will be conducting regular audits that focus on compliance, financial and performance accountability measures. In June, the Secretary of State's office issued a interim report that basically looked at the relationship between the Oversight and Accountability Council and the Oregon Health Authority, and kind of evaluated how effective that relationship was moving forward. So that was Senate Bill 755. I'm just going to shift gears a little bit. Also, during the legislative session of 2021, the leadership of the legislature thought that it was important that, based on advocacy from partners, from community partners, providers, and our organization, that it would be important to get funds out right away to community organizations. As you know, I'm sure everyone knows that COVID had a dramatic effect on the ability of organizations to function at full capacity. There were significant staffing challenges. There are organizations that were struggling all over the state to keep their doors open. And through the HCRA's advocacy with the governor's office and the legislature, and working with the Oregon Health Authority, we were able to get an initial $30 million out from the Measure 110 funds that was invested in organizations all over the state. 70 organizations in 26 counties received funding for access to care grants in that initial release. And according to OHA's own data, more than 16,000 Oregonians accessed services in the first 6 months. And that was under the rubric, under the access to care grants. The law, ballot measure 110, describes two methods of funding. One is access to care grants, and the other are the addiction recovery centers, which were changed by Senate Bill 755 to behavioral health resource networks. And so those are the two types of funding. Senate Bill 755 also required that before any additional access to care grants, or going forward, before access to care grants are awarded, all burns must be funded and not up and running, but the council, the Oversight and Accountability Council, must be complete in its funding of all the burns before access to care grants are going to be released again. And generally speaking, going forward, that process has not yet been defined post-burn development, but it will be a much more formal process than the initial $30 million release. And it would take at least 6 months, and it would be brought in-house for the in terms of OHA's contracting procedures. So that's access to care. Dory's going to talk a little bit about the burns. I'm sure most of you are aware of the burns, but Dory, go ahead.
What's a behavioral health resource network, or what we call a burn? Burns are a set of providers working together as a network to increase access to low barrier addiction services. At least one must be established in each county and offer all these services. Keep in mind, there in some counties, there's going to be more than one. These are the main things that they have to have: behavioral health treatment that is evidence-based, trauma-informed, culturally specific, linguistically accessible, and patient-centered. Has to offer peer support and recovery services. And those are designed to help people continue to address their substance use. Housing, low barrier, temporary, stable and permanent housing, as well as harm reduction interventions, including overdose prevention, access to Naloxone, along with drug education and outreach. Something I like to bring up is I spent some time at OAD. What's also important that they're also required to provide is supported employment.
And one other thing is that the $302 million that was allocated appropriated by the legislature for this biennium represents more than 5 times what non-Medicaid funding a 5-time increase in non-Medicaid funding for Oregon. The other thing I'll say about the funds is that these are ongoing funds, biennium over biennium, and that according to most projections from the Oregon economists, the revenue is likely to increase. So this screen here represents, this is on the Oregon Health Authority Measure 110 website. And what these colors represent are the number of organizations that were approved for funding. There were over 335 organizations considered. There were 239 that were approved to enter into the negotiation phase. And as you can see here, of the 36 counties, 35 counties have been approved by the Oversight and Accountability Council to move their burns funding forward and receive funding. The only one that remains, as you can see, is Jackson County. On the same website, you can walk through, you can see which services are, which burns are activated and what services are being funded. And then you can further go down. This is all on the Oregon Health Authority Measure 110 website, and see how much is going to each particular burn. But what that means for your community, and what we did was the HJRA went through the approvals and looked at all the organizations per county and how much the number of organizations that were approved to continue forward. We got this from the Oregon Health Authority's information, and then how much was allocated to each county. And this represents Jackson County and the organizations that are being funded and the amount allocated for the entire county. And this just also shows how much the amount was for Klamath County, how much the amount was for Benton and Douglas County, just for comparison purposes. And that pretty much concludes our presentation on the regarding an update for ballot measure 110, and happy to take any questions.
Thank you very much. Typically, the slides are available since they are presented at a public meeting. Is that right, Rochelle?
Yes, if they want to forward them to me, I can make sure they become a part of the minutes.
I can forward that to you.
Thank you, Dory.
Thank you, Dory.
Thank you, Mary. There's a hand up.
Thank you so much for the presentation. I was really looking forward to the implementation of Measure 110, and it's interesting to see how it's playing out, and it's too bad that COVID threw a stick in the spokes. Did I hear you correctly that there were 36 referrals through the program, or 3,600 referrals through the program this last year?
No. No, I'm not sure. The only time I used the number 36 was in the number of counties.
Do we have numbers for how many folks were referred to services in lieu of a criminal encounter?
Right. I think the number that you might be referring to is the 16,000 people who received services from the investment of the initial investment of the $30 million. And that was just in the first 6 months. And there are no criminal referrals. If folks choose, if they would like to have if they'd like to get a screening, and if they'd like to have their fee waived, they can get a screening, but you don't have to have a citation or get a screening, or you don't have to have a citation in order to get services from any burn service provider or any funder, any entity that's been funded with Measure 110 funds. You do not need a citation. You can just go and get services.
So we do not give out citations for personal use. They just get the option.
Yes, they are. Yeah, I'm sorry. I should start at the beginning. Yes, there are citations for personal use. However, if a person chooses to have, if they decide that they want to have their fine of $100 waived, they can then go to a provider or call the temporary phone line being housed by Lines for Life, and they can conduct a screening, and then Lines for Life will then submit their verification of completed screening to the court, and then the fine will be waived and the case is dismissed.
I see. And if they don't choose that, there's no one that's encouraging them towards recovery services. That's just they can.
Ideally, the call is the screening, and this is kind of the difference between the phone line and the services on the ground in the community. Ballot Measure 110 and these services are about call for rapid expansion and massive expansion of peer support services, peer outreach, and community engagement. These are folks in the communities interacting with folks who are using, folks who are seeking services, folks who are engaging with the police. This is now a tool for police to be able to engage with local providers who have peers who can then create that warm handoff and develop that relationship and be a local connection to somebody who would like to consider how they would like to improve the quality of their life or choose recovery.
Okay, thank you so much.
Carrie, you have a hand up?
I do. Thank you very much. I would like to ask about what's being done with Measure 110 with the issue about not being able to fund Medicaid funded services. I mean, one of the big things that I've experienced with this changeover is we still do not have enough residential beds. We don't have detox beds. In our county alone, our overdose deaths have doubled in the last year. We have overdose deaths occurring at basically twice a week, and we can't get people into detox. And we don't have the residential beds. So I think there's a big, from my perspective, there's a big gap in what the services Measure 110 is providing and what we actually have need for in order to really save people's lives and get them on the track to recovery.
I'm sorry, was there a question?
The question is, what is being done at the level of, my understanding why the Measure 110 funds cannot be used for direct services such as detox and residential beds is because there's a concern about the federal match with Medicaid and that marijuana.
Can I take that part, just that part? So two things. One, what the law is that you can't supplant existing funds with Measure 110 funds. So if you're currently being funded with Medicaid funds or insurance funds or general fund, you cannot supplant those funds with Measure 110 funds. That's number one. Number two, Measure 110 calls for low barrier treatment, detox, sobering, outpatient.
But it's not funding detox.
Yes, it is.
In what counties? Because it's certainly not, I mean, from what I have seen, if people have insurance.
I mean, I don't want to go too far, but it is one of the elements that is approved for funding, and the Oversight and Accountability Council has funded detox and is funding detox. Lori?
Yeah, if I could, hi Ron, if I could just add, early on, residential detox, anything that was considered higher barrier was excluded. And that has been not consistently applied. So we're aware, and it depended on which committee and which organization for detox and sobering, by the way, also got included in some counties, but we're still pursuing a path to expand detox.
Yes.
And what about, I mean, and that's just the other piece on this.
So just on the residential treatment part is that the ballot measure 110 funds other services, recovery services. So those services are harm reduction, housing, peer support, and low barrier treatment. Treatment, residential inpatient is not included within that except for categorically ineligible, people who are categorically ineligible for Medicaid, and folks who are uninsured or underinsured. In those instances, residential treatment can be paid for.
So is there a track, let's say, because Medicare doesn't cover residential treatment, is there people getting funding for those like Medicare only? I mean, because I think this is the biggest issue as far as if we're talking about low barrier treatment. Most people who are deep into their recovery need more intensive services in order to stabilize. And so are we saying it's not because of the federal match that these funds can't be used for expanding residential services? This was the way the law itself was written, and not because of because I was under the standing there was a concern about the federal match for Medicaid. That is not the case?
I'm not sure if I'm answering your question correctly, but my understanding is that the law, ballot measure 110, clearly states that you cannot supplant existing funding for the services you are providing with measure 110 funds.
So that's the way the state law was written. That's not because there's some federal aspect that is preventing those funds from being used in that way. Is that
Lori,
correct?
Lori, did you want to respond to that?
That's correct from my understanding, Carrie and Ron, correct me if I'm wrong. It's not a federal match issue.
That's correct. It's the state law. You cannot supplant existing funding. So, yes. And then I just want to say that the idea of ballot measure 110 is to not try to duplicate the system that was already in place. The system that was in place prior to the passage of ballot measure 110, which was created in response to the addiction crisis and in response to the overdose crisis. And it was in response to the fact that Oregon ranked 48th in access to treatment and third in the nation in terms of untreated treatment. And the folks who crafted that law wanted to try things a different way, knowing that there were significant barriers to traditional standard residential treatment. There were long wait lists, there were high barriers of entry. And so the drafters wanted to create services, recovery services on the ground in every county that were available and immediately available, from peer services to housing, harm reduction, detox, sobering, outpatient. All those things are accessible now immediately through Measure 110.
I mean, I just, talking from as an on the ground provider, I right now have a patient in a hospital who is pregnant, who we can't get a residential bed for. That's an issue, and so I'm agreeing
with you that residential beds are unavailable. That's correct.
Well, and if that's a state law, I mean, that seems like somewhere we ought to look to change that to be able to fund more services for the ones that we need.
I mean, for some reason, I read the criminal justice report on substance use disorder funding that was dated from 2019. It was an extensive, massive document that talks about the SUD funding system in Oregon and the nature of gaps and needs in Oregon. And gaps and needs in Oregon have existed for some time. And ballot measure 110 addresses one aspect of the need, which is provide on the ground immediacy, personal contact, emergency housing, harm reduction services, peer support to people when they need it, where they need it, based on their current circumstances. And those sorts of, the immediacy and the locality and the geography of those services is the big difference. Is people don't have to go anywhere. They can get the services. They can get a peer who can work with them to support them. They can get into recovery housing or supportive housing, emergency or transitional housing. They can get enrolled in outpatient. If they have other issues of related to their physical health, they can get access to their wound care and other life-saving harm reduction supplies. All those things are now available as a result of ballot measure 110.
I think something I'm not understanding is if we need certain services and use money to create them, I don't see how that's supplanting anything. We need to expand certain services, and we're not seeing those on the ground. I'm not opposed to Measure 110. It's just like there's a disconnect between this is how it looks on paper and then what we're seeing on the ground.
No, I understand what you're saying, and I can't explain how Oregon's SUD treatment ended up in the shape that it's in. I only know that the shape that it was in when ballot measure 110 passed was that folks needed services everywhere, and this is a way to get services to people everywhere. As far as the supplanting of the funding, go ahead, Lori.
I just wanted to add that part of what OHA, whoops, am I muted?
No, you're good.
Okay. Part of what OHA provided in the way of explanation is that they were standing up other funding streams to support residential treatment at the same time. So there's that $1 billion worth of funding that OHA got approved, and that's in process. The detox is absent from there, unfortunately, but we're still pursuing a path for that.
Yeah, I did hear, I got a kind of a lowdown yesterday on the SUD 1115 waiver and how expanding residential capacity is going to help, that by being able to expand from the federal limit of the number of beds, the Oregon no longer has to use general fund dollars to fund those beds, those additional beds in residential treatment, that now that can be paid for by Medicaid. So there is a capacity to expand according to the SUD waiver, as I understand it. So there are other avenues to get to where you're trying to get to, Carrie Heckox, which is the SUD waiver does that, and general fund dollars do that. And, so it's a combination of everything. It's not just Measure 110 coming in and trying to be a silver bullet for everything. We're just trying to address the on the ground, ready to serve needs of community.
Well, that's good to hear that there's more money coming in for residential beds and hopefully detox services, because I think, as you're likely aware, the wait lists for the residential treatments are huge. It is almost impossible to align detox services with direct admission into residential beds because of the wait lists for both. And so with on the ground, and we have peers, it's just very difficult if you have supportive positions where you're not able to move people to the next step that they really need to stabilize. And that's been my frustration with watching this unfold, is that, we have seen a huge uptick in people dying.
Well, I'd be happy to talk more with you about what the philosophy is and the idea, and how the council actually sees the rollout of this, and what the roles of the peers are, and what the role of the housing is, and how that connects to outpatient, and how the entities are going to work together. I mean, I'm not sure if you've been following along with any of the Oversight and Accountability Council meetings, but they've had some very, very deep and granular conversations about the way the services should be delivered, prioritizing communities of color, folks who have been impacted by the war on drugs, folks who need emergency housing, transitional housing, folks who use, it's not the one size fits all, abstinence only 30-day treatment. Is not what Measure 110 is advocating, but we support that, and we want that stuff to flourish. And we believe that with the creation of all these additional services, it'll reduce the burden on residential inpatient treatment, that the lines will decrease, that people will be getting their needs met in different ways. And that's what the hope is.
Any more questions or comments? Lori.
Just one more. Detox requires a spend on medical staff, which is not part of Measure 110. So we have to look to some other resources for that. And so I just wanted to clarify that too.
Thank you.
Yeah, I do just want to mention, I am a member of the Oversight and Accountability Council. I am a chair, and I personally was one of the group subcommittees that approved a detox at Providence Portland Medical Center. So that's why when you say to me there are no detoxes, I can say, yes, there are. I funded one, and it's being stood up in Portland. So with that,
We'd love to have more here.
I support that. I support that. And with that, I'm going to get out of here. I see you guys are talking burn stuff. So any other questions? All right. Well, thank you very much. And I'm happy to come back. I'm happy to, Dory can share my information. Carrie, I'm happy to talk to you and talk this through with you at length, and just let me know.
Thank you very much.
Thank you for having us.
Thanks, everybody. Thank you, Lori.
Thank you, Ron.
Good to see you.
I'm thinking, why don't we switch the next two agenda points and go to Lori? Since you've started talking about what's going on in Jackson County, why don't you just go ahead?
Okay, sure. It's going to be really short. So the negotiations have been going on. We have had some complications for the Jackson County Recovery Network. Things have been shifting. We're back on for one burn in Jackson County, and we're meeting with OHA tomorrow morning to move forward, to finalize and move forward. The next steps are the contract negotiation begins between each entity and Oregon Health Authority. The MOUs all have to be executed. And once that all happens, then they'll fund everyone.
Thank you very much.
There's not a lot to say at this point, but other than that.
Just good to know how it's unfolding around us, because I certainly share Carrie's concerns. Anybody else? Question, comment?
My comment would be then, if this is a law we can change and it's not a federal aspect, we need to look at that. Oh, what do you think?
There's a letter that I drafted for the Jefferson Regional Health Alliance Board that a number of the board members' organizations signed on to our legislators to advocate for the things that need to be improved right now. And it's fairly lengthy and a longer list of things to be improved going forward. I would like to clarify on the detox. Detox was not included. There are discussions underway about the disparities between how the different groups handled the approvals, and we know that the metro area gets more attention. So I would just say that. So yes, there are opportunities, and the legislators' responses have all been very positive and wanting to support being involved in helping make change.
Thank you very much.
Yeah. And by the way, that in the everything in that letter, all of the burn members here locally provided feedback, and then the JRHA board had a panel meeting with law enforcement and Jackson County Community Justice and other partners from education. So we got a very broad base of feedback and things that people would like to see going forward. And I think Stacy is the only other person on the call. I don't know if you want to add anything to that, Stacy, about that letter. No,
I mean, I don't think there's much more to be said.
Well, thank you both. So we'll move to Jackson County Strategic Planning Initiative update, which is Denise, I believe.
Hi, how are you? Again, my name is Denise Acker. I'm with Synergy Health Consulting, and I was the project manager for the Strategic Planning Initiative funded by OHA. And I could share a brief slide presentation that just reviews the process we went through. The project completed in the beginning of July with the delivery of the strategic plan. So I will go ahead and share my screen and talk through the process for those of you that aren't familiar. Okay, so what was the OHA Strategic Planning Initiative? It was 8 months of free technical assistance to county work groups across medical, municipal, and community sectors. And it provided a needs assessment of direct service providers and service users' needs in order to gain a deeper understanding of the impacts of COVID-19 on SUD prevention, treatment, and recovery services. It also included looking at areas for community capacity building and enhancing care coordination. And based on that needs assessment, we supported the development of a strategic plan that addresses the identified needs in the assessment and builds upon the CHIP and proposed burn objectives. This again was funded by OHA. Lines for Life provided contract oversight and administration. Comagine Health provided needs assessment and data analysis assistance. Jeremy Hubbard with Liminal Justice was the community site liaison who supported project management and facilitation and gathered work groups together and leadership to help participate in this project. And myself with Synergy Health Consulting provided facilitation and project management. Here's a look at the work plan and timeline. November 2021 through February 2022, we collaborated with Jeremy Hubbard and to invite SUD and mental health leadership and direct service providers to participate in this project. And based on responses there, we moved into the needs assessment phase from February through April and conducted a needs assessment that included receiving 101 responses to surveys and conducting 18 interviews of 55 participants. And again, this was all collecting feedback on accessing direct services by people with lived experience and gaining input from direct service providers on their experiences with providing those services. And based on that, Comagine Health analyzed the data and developed a needs assessment report and gave a presentation to the various standing work groups. In April through July, we developed a strategic plan that was informed by goals and actions that were outlined at Jackson's Recovery Summit that was held in May and attended by roughly 90 decision makers in Jackson. And also some additional actions were developed through facilitated discussion at the MAT Workgroup and LADPC meetings. So in summary, the SPI strategic plan included actions and feedback submitted by and reviewed by Jackson County Recovery Summit members, MAT Workgroup members, and the LADPC members. And the final strategic plan was shared out with the county leadership on Saturday, July 9th. This is a look at the SPI Identified Challenges on the left that were in the needs assessment report. These challenges were collected by JCC and ARC and included in the development of the Jackson Recovery Summit agenda, where again, about 90 decision makers throughout Jackson County assembled to strategize goals, which we see here on the right, and kind of individual tasks per goal that were outlined in the strategic plan. There's quite a few. It was a very comprehensive day of action setting. And we could see here the key goals are to increase real-time knowledge of available SUD resources in county, increase the peer workforce and provide dual diagnosis training to all staff, increase knowledge and use of Unitas platform and to coordinate care and address social determinants of health, to launch a community awareness campaign that's countywide, to ensure equitable access to community awareness, the campaign and outreach itself, to develop an overdose response work group that's informed by lived experience, and to increase interagency communication and use of peers during transition and wait periods when coordinating access to treatment. As the SPI work was underway, of course, there were already much work was being done within Jackson County that was already addressing the needs identified in the SPI needs assessment. And here we could see all that the burn was putting into place as they were awaiting funding awards. We could also see that the Crisis Response Network has well been underway with plans to establish a non-law enforcement mobile response team and crisis coordination, as well as a stabilization center and housing resources, everything related to coordinating people to stabilization services when reaching out for care. And on the far right, we see here that the local work groups, being the MAT work groups, as well as the LADPC, have been working together with their direct service providers to address issues related to the challenges of treat and fentanyl use, outpatient buprenorphine induction, overdose prevention, harm reduction, naloxone distribution and training, and you can see the rest here. So once the project wraps, really the next steps are to gain consensus on how those actions within the SPI strategic plan that were developed during the Recovery Summit will move forward. I touched base with Julia Jackson at JCC, and they were working with the agency decision makers who attended the summit to gain consensus on how to move actions forward and identify which work group and work group members would take the lead on moving actions forward. And for additional actions that were identified within the MAT work group meetings that build upon what was determined through the summit, Jeremy Hubbard, Sarah Smith, and the MAT work groups were working together to develop real-time warm handoff and resource sharing processes as a immediate intervention to connect people to care while waiting for organizations to onboard with Unite Us. So from here, I'll turn over to Julia and Sarah to give updates on where the actions from the Recovery Summit and the work in the work group meetings have moved to since the project wrapped in July.
Thanks, Denise. Julia, do you have?
Hopefully I have something to add. Thanks, Denise. Yeah, and I think that's part of what we need to grapple moving forward is that there are so many things that absolutely speak directly to the action plan developed from the Opioid Summit. And so I did have a chance to connect with some folks, and actually Stacy Brubaker and I were talking about having the individual who holds the All In for Health project, which is the same as connected to our, our CHIP and our CHA, Andrea Krause, being someone who can hold, and help us track this, the Opioid Summit action plan. I haven't had a chance to meet with her, so I still need to do that. And I'm sure there will need to be supports in place as well. I mean, it's not one person or one entity's project or responsibility, but I think that might help. I don't know, Stacy, if you have anything else to add on that comment in particular.
I was just gonna add that, so public health applied for some public health modernization dollars. And that was part of being able to have us continue to CHIP and the CHA work with Andrea being the lead, but we've also hired a consultant and extra help person to really move that along. And I assume those people will be in contact with you at some point, but really excited to continue that. I know invitations have gone out for kind of a setting point for us to be able to reset and pick up where we got interrupted with our CHIP and CHA and prepare for the next one. So,
yeah, thank you. So hopefully that gives context to kind of how it would be held, and really from that a foundation of someone who's involved in the community population health perspective, I think would be best. That being said, JCC is going to continue to track, to be able to feed that information of things that are happening, and use settings like these also to track notes and things that are happening that relate to the opioid action plan. And so I have a couple of, well, not a couple, I have quite a few updates, and I did email, thank you, Rochelle, to sending that out to the group. There's a lot to read through, so I'm just going to highlight certain things. First off, I thought it would be helpful to share the Unite Us newsletter. I'm going to share my screen. I'm wondering if there are folks, and you can put it in the chat, who receive this. Because you might be on a mailing distribution list to automatically receive this. If you don't, if you would like to, I mean, I'm happy to send it out in the LADPC minutes and in other settings. If you'd like to be directly connected to receive the Unite Us newsletter, let me know. As you can, I'm just kind of scrolling right now through it. You can see one of the things I like about it is the new organizations on Unite Us in the last quarter. This is helpful to see. There's also helpful contact information. There's tips and tricks, kind of who your contact is for the platform. So anyway, I wanted to highlight that because Unite Us was a huge component of, of the opioid summit and what we talked about and being helpful. And then sharing some other pieces, just kind of updates on pathways that we're making to increase peer services. We've engaged with Reclaiming Lives to develop a standing contract of support and formally add them to the network of providers, which I think is really acknowledging the impact that our community-based organizations have just as much as our valued clinical and traditionally clinical providers. I also really wanted to highlight, I mean, I'm sure it would be brought up today, but the September 16th through 17th Overdose Awareness Day with that focus on fentanyl that's coming up for our community is huge. And that's fantastic. We had talked about public awareness events, community awareness events, and that one is just around the corner. Very excited about that. I also recently met with Providence, and they are ready to launch their BOB program. They call it the BOB program, Building Outcomes Through Bridges, which is a peer program to reduce ED utilization. It's happening in other regions, but hadn't happened down here. I met with the program managers. They're fantastic, and also met with Dr. Cole about increasing on-site social worker presence as well, and helping to and then just getting caught up on the hospital-based opiate treatment grant program that they're working on with OHSU. So a lot of really good things happening there. Another topic that I do think is relevant for the group is that, Sublocade has been brought up as a medication, a form of medication-assisted treatment that there is definitely a difficult prior authorization process right now with Care Oregon, and I've been advocating for a long time. I've been here 2 years, and I can tell you that Sublocade has been a part of the conversation for a while, and I've been a thorn in everyone's side. And so I'm excited to announce that we recently are moving towards launching a Sublocade, what I lovingly call Sublocade Fast Pass pilot, like Disneyland, which means that there are 4 prescribers who get immediate automatic approval for anyone that they prescribe Sublocade for a pilot period, which is September 1st until December 31st, 2023. So over a year, during which time we're really going to look at outcomes and overall cost of care and the efficacy of Sublocade versus other forms of MAT. And the 4 pilot prescribers are Carrie Hecox with Oasis, Nat Vondell with La Clinica, Dan Weiner with Rogue Community Health, and Dottie Oliveira with ARC. So excited about that. And then next is we're finalizing a contract with Oasis to support critical housing resources for the pregnant SUD population, and are really gearing up for a population, a prioritized population focus on pregnant, the pregnant population who experience substance use disorder. Let's see, the other thing I wanted to mention is next month, Dr. O'Keefe is going to be presenting data on behalf of the collaboration of CCOs that analyze claims to better understand access to mental health and SUD services based on age, race, ethnicity, language, and whatnot. So I think that also will help us better understand inequities in our current system and things that we can do. That was a component of the opioid summit, was ensuring equitable access. So doing a deeper dive that way is really critical, I think. I also want to remind folks that Columbia Care Services is getting ready to open their Rogue Ridge permanent supportive housing units in Ashland this fall. And a variety of partners are going to be supporting the beds in that building that will be available to our community, because housing was a huge issue in terms of social determinants of health. And then also, we've been doing a round of meetings with the school districts in Jackson County, with every school district, and SUD support has definitely been a focus of conversation. Interestingly enough, what we're hearing is that there are plenty of services that are available in terms of the actual supply, but understanding how to navigate them, increasing awareness for students, for staff, for families, that's really the area of focus right now. And engaging off-campus providers who are part of that network of resources is really critical. And the SUD services is something that the school-based health centers will definitely need support with being able to provide. So it's not necessarily something that can be added to from current services. So if anyone is interested in the school project in particular, so collaborating with schools to increase SUD support, if you're interested in that, I think there's some work that can be done and some discussions to have, and I'm hoping that there are some folks who want to collaborate on that. So just put your name and information in the chat if you'd like to be involved in school. And then last thing I promise is we have been sponsoring through matched funding a public awareness campaign for the past year or so called the Mental Health Minute. I don't know if folks have seen that. It's a Kobe Mental Health Minute, and it's been really powerful. Like it's a powerful media outlet, and it links specifically to what we talked about in the Opioid Summit Action Plan. And so it's already there. So what we're doing is we're repurposing it, and we're going to have a far heavier SUD focus, SUD and co-occurring focus to it. But for branding's sake, we're going to keep it as Mental Health Minute, just because everything is already set up with that name. But for example, in July, we partnered with Columbia Care to highlight peer support. In August, we partnered with Boulder Care to highlight medication-assisted treatment via telehealth, that is an option for folks. And September is going to air soon, and that was with ARC on connections in recovery. I actually just saw it today, and it looked fantastic. And then October is slated to highlight the recovery connections, hopefully with specific focus on Latinx community, and that's going to be through Reclaiming Lives. We just touched base with Stephanie to get partnership there to highlight them. So if you would like to be a part of the Mental Health Minute, for your program or services to be highlighted, please reach out to me in email. And also, I included the link to the Mental Health Minute in that email that Rochelle sent out. And part of what we all agreed to in the summit was that we would blast that messaging and really create a unified front in terms of those types of resources. And so if you could put the link to the Mental Health Minute on your social media or your websites or anywhere else to kind of get attention and reach more folks, that would be much appreciated. And that is all I have. I'm not sure if questions came up. Oh, and I was going to give some.
There's a question.
Okay. And then I was going to give some quick Naloxone claims data info as well, just for the past couple of months. But let me answer questions first.
I had just one question. I put it in the chat, so I'll save you have to read it.
Oh, great.
For the Sublocade program you're announcing, are you still requiring organizations do the buy and bill, or are you starting to do some pharmacy fill for Sublocade?
Unfortunately, it's two separate issues. The buy and bill is different than the SUBLOCADE pilot. The SUBLOCADE pilot only has to do with the fact that those 4 prescribers will bypass review scrutiny for immediate approval, guaranteed approval on those SUBLOCADE prescriptions. So it's totally different than this. However, that being said, I know that this is an issue that Rob and I are tackling just as much as the SUBLOCADE, which has led to this pilot. So I wouldn't be surprised if something changes with that, but I can't speak to it yet.
For now, because I'm not sure if I'm up to date. Is it all still buy and bill for SUBLOCADE currently?
Yes.
Thank you so much for all that hard work. Is there something else you want to say?
Just one more thing. I was just going to share Naloxone numbers. Let me just do that real quick. So this is June 2021 to June 2022. Okay. These are dispenses from a pharmacy. This does not include Naloxone obtained from other sources. So, and then you've got the numbers, the hard numbers here on the right side. So you can see there was a little bit of a dip after December, spiked up in April, but it's fairly typical to last year of where we were. So just wanted to share that as well. Any questions? Okay.
We'll go to all care, and then I'll just note that I was told that we have a couple of members of the public who may be waiting to make a statement at the end, and I'd like to leave 5 to 10 minutes for them to be able to speak. So, Jeffrey, all care.
Hi, everyone. It's good to see everybody again. Don't really have any huge announcements. Thanks for all the information that's been presented thus far. We, of course, would be happy to present our data for Narcan. I just need some notice in order to do that. But I did just want to mention that we hired a new staff member on the behavioral health team. Her name is Heather. She's joined us today for this meeting, and she's the new clinical transitions coordinator. And so, man, I'll tell you, I'm just thrilled to have some extra help, and just wanted to welcome her to this group as well. So again, it's great to see everybody. I look forward to getting back in the groove of these meetings. So thank you, Sarah.
Thank you, Jeffrey. Why don't you just take it as an open invitation to present the Naloxone information or anything next month?
Can do. Thank you.
Thank you. So we'll move to local treatment provider updates. First up would be Addictions Recovery Center.
Hey, Sarah, thank you. I'm Nathan Olson. I'm the outpatient clinical director at Addictions Recovery Center. We are starting a collaboration with Chest Health, which is a mobile recovery app that helps support our clients with their treatment and recovery process. They offer peer services, support groups, and lots of great extras, including a 24/7 crisis support that is online. We also started our 4-day work week with the majority of our staff working only 4 days a week and only working 8 hours a day, so 32 hours a week. And they're still earning the same yearly salary as if they were working 40 hours a week. The only staff that this didn't impact with their hours was our nursing staff, but they did get a raise to kind of offset the difference. They work 36 hours a week. We're also working to increase our access to services throughout the pandemic. We were able to offer about 40 assessment slots a week. We're working to increase that at first to start at over 50 a week and to continue increasing as we continue to return back to campus. And on that note, we have returned back to campus. Our outpatient clinical team is working mostly hybrid. Some of our staff are on campus full-time and others are on staff remote or working remotely full-time, but most are working a hybrid schedule 2 or 3 days a week. We also launched a male and a female intensive outpatient group during our morning group track. So those are in person and those are building. We're seeing some clients come into the buildings again, which is really nice. We're also considering what future client needs we need to look at and which specific groups to bring back to in-person group services next. Let's see, Ready House, our female gender-specific residential program, and it has reopened, and our residential units have returned to gender-specific services, which allows our Mason House, our male program, to be at a full census currently. We're also still actively recruiting for multiple positions, including CRMs, CADCs, LPNs, mental health therapists, and a whole lot more. We also have hired a part-time psychiatric mental health nurse practitioner who onboarded with us in June and is building her caseload up pretty well. She's currently booked out until mid-September, and we're really grateful to have her working with our clients and patients. And that's all I have, unless Lori has anything else she wants to add.
Thanks so much, Nathan. Is anyone here from Medford Comprehensive Treatment Center? Seeing none. Boulder Care?
Hey everybody, how's it going? A great meeting today, and happy to be with everybody. No updates for us, and we just keep trucking on. Thanks.
Thank you. HIV Alliance, I know Dane needed to drop off, but okay. Colpia. La Clinica. Yeah, we're really grateful to be part of the Fast Pass program for sure. It's exciting. So we've started doing more Sublocade injections here at Birch Grove. And let's see, I think we have about 150 patients on Suboxone here at Birch Grove. So it's basically a primary care behavioral health clinic, which is a partnership with many people, many organizations in our community delivering services. And we've given out about 850 doses of naloxone in the last many months. And those are not by prescription, they're kits that we're able to give to patients when they want them. And I think that's it. Max's mission? No, okay. Medford Treatment Center.
They put an update in the chat.
Oh, thank you. Mm-hmm. Will you read it, Rochelle? I'm not seeing it quickly.
Oh, sure. Let's see. We are gearing up for our art show to display recovery-based art created by clients to share with their friends and family. Scheduled for September 9th. Also, we are not currently taking admits for the next few weeks due to doctor schedule for methadone interested clients. September 12 and 13 will be our next intake days. First come, first serve, starting at 6 a.m. For Suboxone interested clients, it could still be possible for admission on Wednesdays. Interested clients need to call and complete pre-screen.
Thank you.
You're welcome.
Oasis.
Yeah, Oasis is getting ready to move into our new building. We are very grateful the time that we've had with the Addictions Recovery Center and all the support that they have given us. We're going to be moving into a facility across the street from Hawthorne Park on Main, where we're going to have our clinical space. Max's Mission will also be moving into our space as well. And then we will have 3 low barrier apartments, which will be for women who need emergency housing, who are active in their use and awaiting residential. We'll be moving our clinical services there probably the first week of October, and then hopefully we'll have the apartments online in December.
Thank you, Carrie. On Track.
Hey, everybody. Eddie from On Track. Not much of an update. I may wear my Max's Mission Overdose Awareness Day Planning Committee hat for a minute, if that's okay. Julie mentioned the Friday, September 16th event. It is a ticketed event. It costs $20. It's from 1 to 4:30 at the Merrick, which is formerly Inn at the Commons. And featured speakers include the fabulous Carrie Hecox, who you've been seeing in this meeting. Also, investigative journalist Ben Westhoff, who wrote the book Fentanyl Inc., which is a really good read. I just read that in the last few weeks. Also, Kelly Olson, Associate Director of Clinical Affairs at Millennium Health, followed by a panel discussion. Should be a really interesting afternoon. The last planning session we had for the whole weekend, the tickets were really starting to sell well. So don't wait too long if you're interested. Friday, September 16th, 1 to 4:30, focus on fentanyl. And for those of you who are interested in continuing education units, you get a total of 3.5 CEUs for that. Also, the Saturday event, the traditional Overdose Awareness Day, is the next day, Saturday, September 17th, 2 to 5 p.m., Hawthorne Park in Medford. Got some great speakers for that one as well. I think we're up to over 20 organizations that'll be tabling. So it's at the corner of Hawthorne Park next to the playground and the restrooms and stuff like that. And I am your contact for tabling if you want any information on that. As far as On Track, doing fine. All the programs are open. Waiting lists for residential, not surprisingly. If we can hire more people, we can take more clients. It's as simple as that. So the jobs are listed on our website. I know everybody's in the same boat with staffing. And we're also starting Chest Health, as Nathan said. So that's really exciting. The 24/7 app for clients. And I think that's it. Oh, the On Pace program. We're starting cohort 3 of our On Track peer and counselor education program, accepting the next round of students who will start in September, October, November. So happy to talk to anybody about what that training program is all about. Thank you.
Thank you, Eddie. We have On Pace trainees at Birch Grove regularly, and they've just been a joy to have with us and to learn from.
Thank you, Sarah.
Mm-hmm.
Julia has a question.
Julia?
Oh, I was just going to say, I just want to make sure that the ticket isn't the cost of the ticket isn't a barrier for folks who want to attend. So if there are needs related to folks who are requesting like sponsorship or scholarship or whatever, like funds that we can help with to ensure folks who can attend, can you let me know, Eddie?
I sure will.
Okay, thank you.
Thank you for that offer, Julia. Oxford House.
I'm just going to introduce myself. My name is Chris Steckel. I'm the new Southern Oregon Outreach Worker for Oxford House, and that is Jackson, Josephine, Lane, Douglas, and Klamath counties. A little bit about myself. I'm a man in long-term recovery. I got my CRM through Reclaiming Lives. I worked as a circle leader there for 1.5 years. I lived in Oxford House in Medford for 2.5 years. I moved to a new house in Grants Pass about 1 year ago to facilitate starting a new chapter there. Yeah, I'm really excited. I just started with Oxford House on the 1st of August, and I will be, coming to the community partners to introduce myself more frequently. Thank you, guys. This meeting's been very informative.
Thanks for being here. Recovery Cafe.
Hi, everyone. Stephanie Mendenhall, Executive Director and Founder of Reclaiming Lives Recovery Cafe. Very proud of Chris. He's amazing. Been with us since day one pretty much, and just rose up into leadership, and it's awesome to see the work he's doing. Oxford House is huge in our community. I know we refer to them a lot every week, and his leadership is really going to make a difference there. So congrats on that. I'd just like to let everyone know that we're still holding 17 circles a week at the Rogue Organic Cafe location. Some of you might be aware that Rogue Organic Cafe closed its doors. And so we're still using this space, and we're navigating a plan to basically find and cook our own food. So that's on our plate to figure out, because they've been doing that for us. So we got some really good opportunities in front of us and some people willing to help out. So I'm excited about that. We are also launching and proceeding with what we call the School for Recovery. It's a term used nationwide for recovery cafes, but really creating more opportunities for people to be in our space every week, learning recovery-based topic areas, everything from activities to groups. Definitely not treatment, but very interactive. And as you know, we have John Boehm, CADC, who leads a lot of those activities. And then we are bringing in some special folks to do workshops and things to create just different opportunities for people to be involved. We also have our El Camino Ciguero night on Thursdays, which is all Spanish for the Latino population. We have 10 men who are coming solid every week and love it. They're very engaged in Recovery Circle. It's been a little bit of an uptake to get people in the door and get the word out there. So we're continuing to, put that out there. But I think I'll send Rochelle some more information on it so she can send it out to you all. But they meet every Thursday at the Rogue Organic Cafe location at 5 p.m. And it's dinner, exactly like our format for the English side, but everything is in Spanish. It's pretty cool to see it all happen. We also are co-hosting the Walk for Recovery on September 30th at 5 p.m. at Hawthorne Park. So appreciated the 30 people who came out for our launch meeting. We now have a link to go in and register teams. So if you haven't received that, I'm also hoping to send that to Rochelle so she can get it out to the committee. Looking for a few business sponsors for that event. Super excited to walk through Medford and wear, the t-shirts all kind of in a unified effort to show the community that people do recover, and excited to participate in the other events that are being hosted in September. So I think, and then also I wanted to mention that we did hire Siobhan Barrett, who's on this call. She is the peer support manager and has been a circle leader with us for over a year and at Cafe for 2 years. She comes from Asante as a manager at Rogue, what do they call it? Rogue Regional. They changed the name. I'm old school. So excited to have her leadership and she's done amazing things in her recovery and is such an inspiration to our people already. So to have her on staff 40 hours is truly amazing for us. But that's what I got for today.
Thank you so much.
Can I add one thing? Do you mind?
Go ahead.
We also hired Samantha Haley as our peer support as well, because we've been gone for 2 months. So we wanted to let you know that we got a female peer support staff as well, and she's rocking it as we speak.
Good point, Brandon. Thank you. I forgot we didn't meet last time. So we are now a tribe of 7, which is cool for us. And we're excited to just be growing along with all of you.
Thanks, Stephanie and Brandon. So I don't think anyone is here from Oregon Health Authority or Oregon Recovers, but the Walk for Recovery was just mentioned. Anyone here that I'm not noticing? Community updates. Naloxone Workgroup. The only thing I'll say really is joy that so many organizations and individuals here are doing their own naloxone distribution, training and education as part of an organic part of what you're already doing. There are treatment organizations, CCOs, health organizations. We get together the first Thursday of every month for an hour. We've done education. Jeremy did a presentation on harm reduction this last month. So if you wanted to kind of learn from other people or just talk to your peers and colleagues about how you're doing that work, you would be super welcome and you could reach out to me. So is there anything else for the business or regular agenda of the meeting before we move to our public members of the public?
The only comment I would want to make is that, and maybe Kira was going to do this, I don't know, but Eric Geyer, our chair, sends you his best. He's doing quite well. He's able to return back to work half-time. And so hoping he's going to take it slow and easy, but he did want to tell you all hello and that he looks forward to getting back as soon as possible.
That's wonderful. Thank you. Best news ever. Yeah, so Rochelle, do you know who the people are who like to make some comments?
I think they can, I believe Rose is one of them. Possibly Lucius.
Rose or Lucius, either one.
So, hi, my name is Lucius Wheeler. I'm a licensed professional counselor based here in Ashland. And I've been listening into the meeting. This is the first meeting. I'm a former outpatient chemical dependency treatment counselor here in the Rogue Valley and now work in private practice. And I just want to say thank you to all of you for doing everything you're doing. I am just so impressed with the extent of work that's being done in the recovery field right now. And I can see the dedication in each one of you. So I am recently relocated back to the Rogue Valley and just trying to get a finger on the pulse of what's happening in the recovery community right now. A new interest for me is I've really been tracking the psilocybin services program that's going to be starting next year. And I'm reading a lot of research that talks about the promising potential for the treatment of addiction in our veteran population and other populations. And so I'm interested in the implementation of this program. And I'm curious as time goes on to stay in touch with this particular group to just see how this new program could be incorporated into the larger network of recovery treatment services that are available here in Jackson County. There are some details that are still being worked out in the program, but a particular interest of mine and a group of my colleagues, including Rose, who was here for the earlier part of the meeting, is to actually offer educational events to our local substance abuse counselors and other mental health practitioners on this new legal landscape and the treatment options that are going to become available as Measure 109 gets implemented here. So yeah, anything else I want to say about that? I'm looking forward to staying in touch with this group, and I would encourage any of you who are interested in that particular topic to reach out to me directly. I'm happy to put my email here in the chat. And we're hoping to offer some free educational events and conversations that can be like focus groups for local professionals to just talk about this new situation, these new options. And we'll also be working on this opt-out campaign that's taking place here in Jackson County, again, to provide information and education for anybody that's just wondering, what the heck is this new psilocybin program? And again, how can that interface with our existing options for treatment? So if you have questions, please reach out to me. You'll probably see my face again, or my colleague Rose, or some of the others from the group I'm working with. So thanks a lot.
Thank you. What is the name of the group that you're working with?
So that is a really good question. I wish I could say a name. So we all came together as a group that's advocating to say no on the opt-out vote that's happening here in Jackson County. And we're currently coming up with an actual name for our group. So right now it's just the Jackson County Psilocybin Services Initiative.
Okay, thank you.
Yeah, thank you.
When we plan this meeting, there's kind of an offline small group that plans it. And what the topic of psilocybin and its use is something that's come up. And I think we don't need to get into it here particularly, but if you have an interest in, as Lucius, was saying, it might be something we'd look to have more education about. So just let us know if that's a topic of interest to you.
Sure. If I could just make one brief comment on that, if that's okay. Folks who are on Netflix may be aware that there's a new documentary series that came out on Michael Pollan's book, How to Change Your Mind. And there's a multi-part series on different substances. It's pretty interesting because it does show some new advances in research that are taking place. And specifically, I believe it's episode 2 of that series focuses on psilocybin mushrooms. And it's a good just general introduction to the spirit of this Measure 109 and the research that's behind it. So if anyone's curious, that's a really good place to start. It's about an hour and pretty easy watch.
Thank you very much.
The other thing I would just say, Sarah, is in addition to whether this group's interested in education around psilocybin, is any other topic you would like for us to consider holding at this meeting? All you need to do is email that to Rochelle, and then when we have our planning meetings, we can figure out the priority direction of that and be able to figure out who we need to invite and support your requests. So send those on to Rochelle if you have those.
Thank you. Well, are we entertaining a motion to adjourn?
You did a great job, Sarah.
Thank you. Eric's on his way back.
You did great, Sarah. Good job.
Mary has her hand up again.
And please speak.
Hi, I'm sorry. I missed the name of the gentleman who just spoke about the psilocybin measure about 109. Are you still there, sir?
Yes, I am. My name is Lucius Wheeler. It's L-U-C.
Hi, Lucius. My name's Mary. Anyway, I'm a huge supporter of expanding mental health treatment with the use of psilocybin. And I found that most folks that are opposed to it just have absolutely no understanding of the modality of its use. And I would recommend strongly, as you present to other care providers here in the Valley, of maybe collecting some video clips of that presentation that could be condensed into an easily digestible, accessible, informational video. You know, unfortunately, most voters don't have the bandwidth or the attention span to consume large quantities of information. And I do think that it's so important to expand this method of service. So as your organization works for supporting 109 here in Jackson County, if you could just kind of think from like a marketer's point of view of how we can get the most poignant aspects of this treatment into small, easily digestible marketing materials so that voters really understand what it is they're looking at. Anyway, that's my 2 cents. So thanks for all the work you're doing.
Thank you.
I just would want to flag, just as a cautionary, just to remember that this group is really an advisory group to the commissioner. So we really need to stay away from taking stands on one side or the other. They did make the motion to put it on the ballot, which I really think that that was the best decision they could make, given the circumstances. So just want to make sure that everyone's really aware that that is the premise of this meeting, is to give recommendations to county commissioner. And so just to be cautious about how we want to approach that. I think education is one thing, but promoting voting one way or the other at this point would not be the purpose of this group.
But we are glad to know that it's on the ballot, Stacy. That's a great point. Okay, any other parting thoughts? If not, would someone make a motion to adjourn?
So moved.
Thanks, Jack. Second?
Second.
Any opposed? Okay, thanks for a great meeting, everyone.